There's a crucial molecule in your body that helps control everything: your circulation, your energy, your stamina, your heart, even your sharpness of mind. It's called nitric oxide. But after age 40, your body makes less and less of it. Less blood flow, less stamina, less of you. But now there's N101, the nitric oxide lozenge developed by Dr. Nathan Bryan, the world's leading nitric oxide researcher backed by Nobel Prize-winning science. N101 is designed to naturally restore your body's nitric oxide levels. Just do what I do and let one dissolve in your mouth twice a day. I especially make sure to take it before workouts. N101 goes to work in minutes, releasing nitric oxide directly into your bloodstream, supporting healthy circulation, boosting oxygen delivery to your muscles and brain, helping you feel the way you're supposed to feel. More energy, better blood flow, sharper focus. Day after day. N101, it's the science of you working better. Visit HoffmanNO.com. That's HoffmanNO.com and use coupon code Hoffman10 for 10% off N101. Welcome back to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. We're talking to Reed Davis, who is the founder of FDN. That is not the Fire Department of New York. That would be a Y in the end, but it kind of sounds like it. It's functional diagnostic nutrition, and functional diagnostic nutrition is a way of looking at physiology in a more comprehensive way, capturing subtle imbalances in hormones, in the gut ecology, and so on, and incorporate it in a process of trying to get people optimized. So, Reed, you were going to give us an illustration of how this might work. You have a case study that you mentioned.
I have hundreds. Hundreds, of course, but one that came to mind in the first half of the show. I thought about a woman who came in the office a long time ago when I was really starting out, over 20 years ago. She was coming in actually for chiropractic and acupuncture, getting more of the physical sciences. She would get some trigger point therapy and a heat pack and a chiropractic adjustment. And she wasn't my client yet. She came in. I greeted her. I walked her to the treatment room that she was going into, and she looked really down, Doc. I mean, really down. And she had normally been fairly chirper. And I said, "Hey, what's wrong?" She goes, "Oh, it's this weight, Reed. I'm 40 pounds overweight, and I'm just sick of it. I'm sick of it. I'm so frustrated with this extra weight." And me, the happy one, every time I went to get a word out, like, "Well, what are we going to do?" Or, "Hey, we could, no." She just kept saying.
And Reed, you immediately said, "Hey, we have Ozempic now. We have Mounjaro. We have Zepbound. So we just give you weekly injections and you'll be fine."
Yeah, you need some fat pills. So, no, I was going to recommend something, but as she went on, she said, "It's so frustrating because I'm 40, and there's nothing I can do about it because I'm on this medication for the hives."
Oh, okay.
And so she says, "I've been on it for 2 years and I've gained 40 pounds and it's just so frustrating." And again, I'm trying to get some words out like, "Well, we could, and she's like, "Oh, Reed, and it's just so bad because I went to the doctor the other day and I said I was really frustrated with the 40 pounds. And according to her, this is no disparagement coming from me at all, but her, I guess probably allergist said, lady, you have your choice. You can be fat or you can have the hives.
Oh, boy.
Take your pick."
Yikes.
And so she just said it almost drove her to tears. And she told him, "That's very depressing, doctor." And of course he said, to your point, "We could certainly write your prescription for antidepressants if you'd like."
There you go.
And so finally, and I said, "Oh, well, now I know why you're feeling so lousy today. I understand. I'm very sorry to hear that. Why didn't you ever try to find out why you get the hives?" And it was like, what? Her head snapped around so hard, I thought she wouldn't need her chiropractic treatment that day. It just like almost came off her head. What? I said, "Yeah, why don't you try to find out what was giving you the hives?" Hadn't occurred to her practitioner who's prescribing. And long story short, I sent her home with a couple test kits found out some things that were likely contributing. And within 9 days, she was off her medication because she'd found out what gave her the hives. And it was simply food. She'd been eating certain foods every single day. That's what we assumed. We ran that an environmental pollutants panel and some things, but ideas using our detective work, we got to the underlying cause or condition. And within 2 more weeks, she told me, and I'll end with this, Reed, I can't tell you how happy I am. This is why our work is so rewarding. I'm not only am I off the medication, but I'm actually losing weight now because I'm in the gym working out to a sweat, and I'm also taking hot showers, which I haven't done in 2 years.
Wow. Yeah, hot showers are really problematic for people with hives.
Even on the beds. Yeah. So anyway, bottom line, she was off the medication, taking hot showers, working out to a sweat, and losing weight, and just a whole different life. That's from simply being a health detective, trying to find out the underlying cause or condition instead of just treating her symptoms. And I just knew that I was doing something worthwhile at that point.
So I have a question for you, because presumably an allergist would have undertaken some kind of workup. Typically, they will run a blood panel because sometimes in people with severe allergies, it's dangerous to prick the skin because it might cause an anaphylactic reaction. So they do a blood panel. The one they do is an IgE rest. I rarely do that panel because it's always negative, unless someone has an obvious reaction. And if they have an obvious reaction, you know what they're allergic to. If they, start to have trouble breathing when they have, peanuts or dairy or something like that, that's pretty obvious. Anyway, you don't need a test to demonstrate that. But so that test is limited. What tests do you think are a better way of assessing allergy that helped you in your detective work?
That's a great point, because especially with children who have bad skin conditions and ADD and all kinds of horrible things going on, they've already been IgE tested. They've had the little skin prick test, some other test, the RAS test, like you said, and they've shown negative, or they got off of whatever that indicated and it didn't help. So we use the mediator release test. I'll tell you, it's from Oxford Biomedical.
Mm-hmm.
And they're a lab in Florida. It does require a blood draw and an overnight shipment. So they need fresh, live blood. They do what's called a mediator release. I won't go into all the details, but it tells you what you're reactive to.
Mm-hmm.
So your white blood cells will release these mediators, granulocytes, and other things. Tell us this food is reactive. And that's, you don't need to know all the details. It's reactive. Now, getting off of it can help you. It can help you a lot. It could help you a little bit. Mm-hmm. So that's the thing. Looking forward, you can't predict who's going to help the most. But in looking backwards, my God, if I hadn't run that test, she'd still be on her medication, probably weigh 400 pounds or something. And the same test has helped me so many times with other conditions, as I mentioned, other skin conditions. And even I had a principal call me. Billy's a totally different kid. He was poking the other kids and outbursting in class. Matter of fact, his mom had said, Reed, they're going to send him home from school if I don't do something. Ran a couple labs, found out what he was sensitive to, changed his lifestyle. So the principal tracked me down and said, this is a different kid. What'd you put him on? Mm-hmm. Which I thought was funny. Like, he wanted the magic pill. And I said, well, we put him on a better diet, a better sleep routine, getting him to do his homework and getting him some exercise, which schools don't seem to think are very important anymore. So we changed his lifestyle, I said, and he didn't want to hear too much after that because there was no magic pill. But there was a way of thinking that got us to the underlying causes that changed his life forever. Same thing. I taught coach football for 15 years and had kids on my team that didn't want to show up for practice. They were having asthma attacks. Got very good results with that, simply by running the right labs. And they're not conventional labs. You know that to this day, that Oxford Biomedical, I'm giving you the lab, the mediator release test for 176 foods. That's the one. No one eats 176 foods, but it covers a lot of ground. Mm-hmm. And it's still not covered by insurance. It's
it's not. It's considered experimental.
I don't understand that.
Yeah, I think there's a real bias against tests that are, shall we say, outside the realm of conventional medicine. but that still can be very
But they
valuable.
should be first line.
Yeah,
I mean, my
absolutely.
opinion. Yeah.
Uh,
Yeah.
yeah, go ahead.
Just
I wanted to ask you, look, often we see patients who have physical problems and it's attributed to psychological issues. Like if you're having, I don't know, like you're exhausted, it's considered a form of depression. If you're complaining a lot of aches and pains, it's considered that, perhaps you're somaticizing. That's a fancy word, which means that you're placing some of your stresses into your body. And there's some legitimacy to that. There really is, psychosomatic medicine, I think, is an important area in our understanding. So the solution of conventional medicine is often either uh, medication or, better yet, maybe a long course of psychotherapy, maybe cognitive behavioral therapy, which is shorter. But you actually have embraced something called EFT, emotional freedom technique. And I've known several practitioners who really believe in its efficacy. And I wanted to hear a little bit from an experienced practitioner about what that's about. And it's not to deny that there are physical concomitants to your problem. It could be a food allergy. It could be, your circadian rhythm. It could be need for more vitamin B12. I'm just picking one among myriad examples. But there is an emotional concomitant to many conditions. So how does that work, EFT?
if it's okay, like I always do, I'll give us a little bit of perspective
Sure.
to the answer.
Yeah.
The perspective is that we're looking for stressors. Almost everything that an FDN handles is a long-term chronic stress-related condition that's creating a downward spiral, and sometimes that downward spiral is very complex. There's a lot of dominoes falling, all kinds of symptoms going on. And so we can look at, again, the labs, find out what is imbalanced, out of balance, dysfunctional, bad pathways, this and that, lots of things going on. And you can give people things to do to get better. Now, when you are finding that it's emotionally attached, and by the way, this is very interesting. There was a study done recently by someone, a doctor at the University of California, San Diego, that indicated that stressors, yes, they're at the heart of most common conditions, probably 80% of all conditions. And the stressor doesn't even have to be there anymore. In other words, the downward spiral that it created, whatever it was, just continues. Well, the stressor's gone. You might not even remember what the hell it was.
It was a trigger.
But it has an effect.
Yep.
So a lot of this, you mentioned the somatic, and that's really important. There's the autonomic nervous system and the somatic nervous system. And you can have symptoms based on these nerve impulses continuing to go through the body, producing something, whether it be eye twitch or even something worse, some really bad pain.
So in effect, they're stored in your tissues, whatever the target organ might be. It could be, low back pain, or it could be even, a dysfunction in one of your internal organs. Is that right?
Yes.
Okay.
Absolutely. So the best I could equate emotional freedom technique, the EFT. I think originally it was called something else, and it's like sort of psychological or neurological acupuncture. So it's acupuncture. So there are these points in the body, and you can connect to your thoughts and your emotions and what you feel. And you can say things to yourself, even the practitioner, while you tap. And there are what they call gamuts or tapping points, top of the head, above the eyes, outside of the eyes, just under the eyes, just under the nose, just under the lips, and on the collarbone, underneath here, and even your two wrists together. I've seen it work, and it's worked on me because it sounds goofy.
Yeah, it does. On the face of it, it sounds weird, like a tapping, tapping kind of thing. Yeah.
First, I learned of it was in a hypnosis class.
Yeah.
The hypnosis teacher also taught that, and I thought, oh, this is wacky. I thought the whole thing was wacky anyway. Yeah. But then I tried it, and my fear of heights went away.
Yeah.
I no longer, from one session, I used to not even be able to go on a third floor of a hotel and go on the
Wow.
balcony. I
Wow.
would get weird
Yeah.
equilibrium
Yeah.
problems. I just couldn't even look over and that went away from the 10th story.
Huh.
Like I'm not going to jump, I'm not going to, fall and things. And that was that. So that emotion,
Yeah.
I got free from
Yeah.
whatever the hell that was.
It sounds
And
like
so
it's like kind of a reprogramming, and the touch aspect is essential because it's more effective than just talking to you. That maybe putting
the
a
touching is critical.
sensation into your body kind of embeds the whatever the message or the reprogramming that you're trying to accomplish.
Yes. On these very well-known acupuncture points.
Hmm.
So you got to do it on the points, and there's a
It's
system and a
not
method
random.
for
It's
it.
not random. It's not just like tapping you on the shoulder, right?
Not random. You can even use it secretly on someone. Because I helped somebody who was scared to death, and I went and gave her a few taps on the head and said a few things to her, and because we were going shark diving, and she wouldn't get in the water, she was holding on. Well, and her boyfriend had took off and gone in the water. And I said, I just went up to her. I know it sounds fishy, and I don't like really mentioning it all that much because of how it sounds, but I've
Right.
seen it work. And
Reed, remind me not
three
to go
minutes later,
shark
she was in the
diving with
water.
you because you might tap me and I might then expose myself to something that it may not be that. No, look, I'm a scuba diver myself and I've seen sharks underwater. Some people find it unimaginable that you can actually swim with the sharks, but I've done it and it's actually pretty cool. So, no,
It's very cool. My son and I were in Hawaii and did that and skydiving, the whole thing. So, yeah, we like our
wait, you did
challenges.
skydiving after being afraid of being on a third floor balcony?
Oh yeah, yeah. That it's funny because I didn't even put that together, but I've gone more than one. My son is a certified skydiver, and we were in Hawaii. We did shark diving like at 10 in the morning, and went straight from there to a skydiving place on northern Oahu. Yeah, so you can overcome a lot of these things. Now, I wouldn't go much deeper than that with it. Um, I'm not an expert in it. I got trained and applied it back when I worked in the clinic a little
Hmm.
bit, but now there's people so much better than me, and that's the other thing you learn in our business is you know
It sounds
send
like,
them to the right person.
yeah, so make a referral.
Has your digestive health been striking out due to poor food choices, medications, stress, and other lifestyle issues? This season, hit a home run for your digestive health with Dr. Ohhira's Probiotics. Dr. Ohhira's Probiotics is a live probiotic encapsulated in small, easy-to-swallow capsules that delivers Dr. Ohhira's signature blend of pre, pro, and postbiotics. Dr. Ohhira's award-winning formula contains a prebiotic blend of fruits and vegetables, which are naturally fermented with 13 strains of live probiotic bacteria for a minimum of 3 years. The result? Dr. Ohhira's game-changing postbiotic metabolites, which are key to supporting long-term digestive, immune, and cognitive function. Dr. Ohhira's Probiotics, an all-star formulation and the best probiotic on the market today for overall digestive health and wellness. Dr. Ohhira's Probiotics, available at Sprouts, Natural Grocers, and other natural health retailers nationwide.
Reed, it sounds like, this is something that could be useful for the patient. You have all the right ingredients, you have all the right, suggestions, all the right therapies. The patient is just stuck. And you might have to overcome some barriers to recovery that are embedded in their somatic nervous system that really prevent progress. So I appreciate that, you use that as part of an all of the above approach. I wanted to focus also a little bit on the gut because more and more we're coming to appreciate the gut-brain connection, the gut-immunity connection. The gut is so essential in even metabolism. We know that taking even certain functional probiotics can improve metabolism, reduce insulin resistance. They're really pioneering this now. How do you approach that issue?
The digestion is incredibly important, and people talk about the gut as a big part of the immune system, which it also is, but they work hand in hand. So as I said, I could show you, and I teach this a lot on my slides and things that I go through the anatomy and the physiology. And when someone's stressed out, yeah, their cortisol and DHEA get out of balance. They get into a catabolic state. Their secretory IgA, which is the immunoglobulin that lines the gut, lines the inside of your small intestine. It protects you from germs coming down the pipes, basically. And it identifies things that don't belong there and helps sequester and excrete them. But what happens is, as your CIGA levels go down, you get an imbalance in the microflora, in the biota. And there's always some negative bionts there. These, whether it's bacteria or what. There's
and by the way, let's just remind our audience that secretory IgA is very easy to test. You can take it with a blood test, but more easily and more readily, you can actually just do a spit test, and it's inexpensive.
It's included in our saliva test for hormones
for the adrenal panel. Yeah,
get it all at once.
Yep.
So as your CIGA goes down, you get this overgrowth of the more negative flora or bacteria in the gut. Now, what happens is your digestion goes down. You can't break down protein the way that you used to. So you used to be better at breaking down protein. This is when people start getting gas, bloating, indigestion, heartburn, diarrhea, constipation, darker stools, and smelly gas. It's much smellier if you don't have a good protein breakdown. So, and that happens. Well, then what's next? Carbohydrates start to ferment. That produces gas and bloating, and you can tell. And then fat digestion goes down too. This is where I don't want to say, the greasier.
There's an oil slick, and it's not in the Pacific Ocean. Yeah,
and
right.
you get steatorrhea, floating stools, and so digestion is incredibly important. So before I go to the immune system, I go to digestion. That's the first thing. Now, when you're not breaking down and absorbing all of the vitamins, minerals, essential fatty acids, antioxidants, trace elements, phytonutrients and things, you are malnourished. You might be spending a ton of money on good organic food. You're trying not to consume a bunch of chemicals and things like that, but you're not getting the nutrition. And then all kinds of things happen after that, including the immune system continues to downward spiral, because with the dysbiosis, now you're susceptible to bigger, badder bugs. That's a real medical term, by the way, bigger, badder bugs.
Exactly.
And so you get worser bacterial overgrowth and biofilms and viruses. And by the way, fungus is huge. People walking around with chronic, candidiasis and things like that. So
the so-called yeast connection. Yeah. Mm-hmm.
Yeah, the yeast, is horrible. And it permeates the mucosal barrier, not just in the gut. It ends up in the mouth, the sinuses, the vagina, if you have one, and all kinds of areas like that. So it really is a downward spiral that begins with stress. I know there's an old saying, matter of fact, Hippocrates, the father of medicine, said all disease begins in the gut. Who am I to argue with Hippocrates? But it doesn't. It circles around in the gut so commonly and so frequently that we think it all begins in the gut, because your symptoms might start there. But I've done the homework, I've done the science, and I could show you the tests we run and how the dominoes fall. That stress raises cortisol, lowers CIGA, creates a dysbiosis, creates an environment that's good for bigger, badder bugs and biofilms, and it's just one thing after another. Eventually, you end up with leaky gut, and now you've triggered the humoral system. You got things going through the gut that shouldn't, and you trigger the humoral immune system. Now you get autoimmune and all kinds of really nasty things. You end up with more inflammation and inflammation-driven cardiovascular or whatever it might be. That, and you add blood sugar problems to it, and you get real messes.
Indeed. I mean, that is now very much acknowledged, even by conventional medicine. And there's a bunch of startups that are looking at the possibility of fecal transplant, taking basically poop pills but also, what are called functional probiotics that are designed to address immunity. Maybe somebody's getting too many urinary tract infections, or perhaps
I'd start there before I go to the fecal transplants,
right.
Because
That's a little extreme. Yeah.
One thing, it's pretty drastic to be taking someone else's poo.
Yeah.
And these are oral. It's not like they're sticking things up your rear. You're eating these pills that contain someone else's fecal matter, and how it survives into the small and large intestines is still beyond me, because everything is so acidic in the stomach. It's going to neutralize. Matter of fact, most probiotics are neutralized before they even get to your small intestine. So that's why they come in very high strength doses, like the 40 billion,
right.
50 billion, cells before you get to where they're effective. And prebiotics have to be included. The best scenario is to think of it as a garden that you want to fertilize with good fertilizer, which is your prebiotics. This is why we need fiber,
which is
in
the
our
diet,
diets.
which just comes back
the old
to
apple
diet.
a day. Apple pectin is one of the most effective fibers on the planet, anywhere, in any country, any language. Apple pectin, I think there was a saying a long time ago, something about an apple a day.
Something along those lines.
but there's some truth to these old things that, thank God, my mother knew about, and she's still living. She's 93. Stuff we did as kids, nobody else was doing. We were the weirdos, the weirdo family.
That's a good Canadian upbringing on the farm.
Yeah, other people would worm their dogs. My mom would worm her 3 kids.
There you go. Well, there's something to be said for what's called the hygiene hypothesis, is being exposed to pathogens, normal, childhood infections, may actually bolster the immune system. We're too cosseted and comforted in this modern antiseptic lifestyle that sometimes renders us more vulnerable to infections. Okay, great stuff, Reed. So a couple of things. First of all, are you a practitioner? Do you see patients? And since this is a national show, you're located in San Diego. Do you do telemedicine, or do you work with clients remotely, or are you mostly teaching your FDN?
Yeah, thank you. I just teach.
Okay.
But I have lots of practitioners. We're everywhere. We're FDN practitioners are showing up. A lot of them are independent health entrepreneurs. They have their own practices. A lot of them work for doctors.
And they're health coaches mostly, right? Okay.
Well, they operate from that format. They're really health detectives. They know how to run the labs. This is why a lot of doctors are starting to hire my graduates, because they want someone that knows a thing or two, that has the anatomy, physiology, biochemistry, and all of that down. And because that's what I teach, is the hardcore science. But if people wanted to find a practitioner, they could go to fdntraining.com/medicine. That's in honor of the Intelligent Medicine podcast. We came up with that URL just for your listeners.
Oh, that's great.
fdntraining.com/medicine. And that would, it's not medicine, but again, it's just in honor of your show. We called it that. Mm-hmm. And that way it's
like a dedicated portal for our audience. That's great.
Yeah, we have an alumni that's unbelievable, caring people. Again, I've trained them and sort of set them out into the world to find their way. But we also, that's why we have the alumni. It helps them find their way, whether they're an independent practitioner or working in an office for a physician, which I think is a phenomenal opportunity, by the way.
Well, great. I mean, it sounds like you're at the tip of the spear of the health revolution that is seeking to address some of the inadequacies of our conventional healthcare system. So, really appreciate your efforts. And
we're in the mix.
Yeah, well, and it's amplified because of your, thousands of graduates in 50 countries. You're not just a one-off. You're getting the word out, and your disciples and trainees are spreading the word about some of these important modalities and a more comprehensive way of looking at things, which is really great. So I appreciate it.
Thank you. We're still learning, and we got to say that you can't keep up with it all, so that's why the basics, the foundations, are so important. Because if you chase the rabbit holes or go down too many of them, you'll just end up not helping anybody.
Absolutely, and that's why I enjoy the practice of medicine and doing these podcasts, because it's a constant learning experience, which is what I've signed up for. Thanks very much for joining us. Reed Davis. I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast. I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything Intelligent Medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations. You're listening to Intelligent Medicine, a resource to help you take control of your health. We offer a balanced, objective analysis of all your health, wellness, and aging options, both conventional and alternative. Now you can take your engagement to the next level by joining FullScript. FullScript is my online dispensing platform that only offers curated, professional-grade supplement brands that I know and trust. Never counterfeit or expired, always stored and shipped correctly. Just go to drhoffmanstore.com for more information and to start your free FullScript account. Buying through FullScript offers fast, free shipping, optional refill reminders, a mobile-friendly site. It's safe, secure, and HIPAA compliant and offers world-class support. Just go to drhoffmanstore.com. You'll get access to the supplements and features you need to help you achieve your wellness goals, including my custom targeted protocols that combine the products I recommend to address specific needs, heart health, immune support, and much more. It's all at drhoffmanstore.com. drhoffmanstore.com.